The AATT trial addressed the first-line treatment of peripheral T-cell lymphoma. This is a multicenter study of the German group, GLA, and the French group LISA, comparing a consolidation by allogeneic transplantation and a consolidation by autologous transplantation after an induction treatment of CHOEP14, then DHAP. 104 patients have been included since 11 to July 14, before the study being prematurely closed after the interim analysis. The primary endpoint was to improve the event-free survival by 25%. We presented here the result of the final result of the study, and we show that there is no improvement in EFS, in overall survival, by using allogeneic transplantation compared to autologous transplantation. We saw that 30% of the patients do not reach the level of receiving a consolidation, mostly by primary progression of the lymphoma. We also saw that there is a difference in the cause of death in this study. Most deaths in the autologous arm are related to lymphoma relapse. Conversely, the deaths in the allo arm are correlated to toxicity. When we compare the event-free survival of the patient actually transplanted, we found that there is an equivalent event-free survival, but we can see that there is, comparing the cause, the kind of event, there is probably a deep prevention of relapse by allogeneic transplantation. But the effect of the prevention of relapse of allogeneic transplantation is unfortunately counterbalanced by the toxicity. So in the end of this study, we could not recommend doing allogeneic transplantation frontline in peripheral T-cell lymphoma. But we find that, again, we can see the allo effect against lymphoma of allogeneic transplantation.